Now the cranial nerves. Cranial nerves, olfactory. Second nerve is optic. Third nerve is oculomotor. Fourth nerve is trochlear. Fifth nerve is trigeminal. Sixth nerve is abducens. Seventh nerve facial. Vestibulocochlear. Ninth nerve is glossopharyngeal. 10th is vagus. 11th is accessory. And 12th is hypoglossal. Now, most of them, the olfactory, smell, optic, vision, oculomotor, the muscles, and trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, hypoglossal. Now, cranial nerves, sensory nerves are 1, 2nd, and 8th. Motor nerves are 3rd, 4th, and your 6th, and your 12th nerve. This is motor nerve. Mixed nerves are 5th, 7th, 9th, 10th, 11th. You will be knowing that it is a sensory, which nerves are sensory. It can come as an MCQ. Motor nerves and mixed nerves. Or a short note on this aspect. Now you see the cranial nerves nuclei. See the location. Total location of the, you see the undersurface of the brain. You open your tab, your book, dissector, and see and compare. And I told you, group study. So you can see the thing. You can, your optic nerve, this is olfactory, and trochlear nerve, abducens nerve, facial nerve, glossopharyngeal nerve, hypoglossal nerve, and vagus nerve. And this is the accessory nerve, vestibulocochlear nerve, trigeminal nerve, mandibular nerve, and maxillary nerve, ophthalmic nerve, oculomotor nerve. Again, it's a repetition. Cranial nerve nuclei, the optic nerve, trochlear nerve, abducens nerve, facial nerve, glossopharyngeal nerve, hypoglossal nerve, and vagus nerve. Olfactory nerve and tract, oculomotor nerve, ophthalmic nerve, maxillary nerve, mandibular nerve, trigeminal nerve, vestibulocochlear nerve, accessory nerve. Now, this is a picture that's depicting where it is supplying. Now, this is it's a sagittal section of the skull with the brain. And you can see the nose and the section of the nerves are here. These are the cleft-like structures are there, covered with mucous membrane. The second nerve, you see the supplying the eyeball. And here there are nerves, third nerve, and this is the fourth nerve, and the sixth nerve. And this is your supplying the face. Here, seventh nerve, again supplying the face. This is the cochlear apparatus, the eighth nerve. And this is ninth nerve, begin supplying your ear. And your 10th nerve, vagus. 11th nerve, 12th nerve. This is So this is a very important picture. You can here see olfactory nerve, the olfactory bulb, and these are the anterior ethmoid nerve, septal olfactory nerves, internal nasal branch, and your anterior ethmoidal nerve. Pterygopalatine ganglion, this is pterygopalatine ganglion, pterygoid canal, yeah, and nasal septum, nasopalatine nerve, nasopalatine nerve, this, and your greater palatine nerve here, this is palate, and lesser palatine nerve here. This is the greater palatine in anteriorly, posteriorly the lesser palatine nerve. Now, optic nerve, the left visual field, the right visual field. Now, you can see the crossover. The right eye, this is the optic nerve, this is the left eye, this is the right eye, and optic chiasma. This is the question that comes in optic chiasma. Short note on optic chiasma. You have to just draw this figure and color. You just do draw an eyeball here, and this is the part of the retina. Now this in one color half, and it goes, and the other color you take, say any color you like, it goes there, crossover, and it goes into the optic radiation in the occipital lobe. Optic chiasma, brain, left eye, right eye, you just, initially you might feel this stuff, but when you draw two, you take the right visual field and the left visual field, then in two colors, you just go this, supplying both eyes. Now here's one, then you join them and crossover. It goes optic radiation into the occipital lobe, this area. Now sometimes what happens in an accident or anyone hits you on the back, on the occipital, then if there is also hemorrhage or very deep injury, then what happens? There might be, if the blood vision might complain, patient might complain, hey, তুমি দেখতে পাচ্ছ, এটা কি রং, জামার রং দেখালে, বা সে সালোয়ার পরে আছে, চুন্নিটা নিয়ে বললে এটা কি রং? You have to ask her in an emergency. Then now trigeminal. The ophthalmic nerve, trigeminal nerve is the maxillary nerve, mandibular nerve. 1, 2, 3, you draw a figure like this, and then the area of innervation. 1, 2, 3. Ophthalmic, maxillary, mandible. Now, the facial nerve. See, the yellow is the key here. Branchial motor, visceral motor, special sensory, general sensory. So you have to draw it in color, and you see internal acoustic meatus here. Internal acoustic meatus. This is the motor nucleus of the facial nerve. This is the motor nucleus of the facial nerve. This is the brain. You can see the brain and your posterior auricular branch, styloid foramen. This is styloid foramen that comes, the bunch comes down through the foramen, styloid foramen, in this yellow, supplying the face. Branchial motor, and this is the visceral motor. The visceral motor in red. You hold your fingers like this, and the supply is that. Now, vestibulocochlear nerve. This is the cupula. Now, you see the external auditory canal. This is ossicles of the middle ear. And you can see the pathway, the vestibular nerve. This is the cochlear apparatus of the ear. Now, stapes, incus, and malleus, the small bones of the middle ear cavity. This is the tympanic membrane. Now, once the sound goes, it vibrates, and these your stapes, these are stapes, incus, malleus. Now, this is the cochlear apparatus, external auditory canal. Now, this is the brain stem, the tympanic membrane, the tonsils, and your glossopharyngeal nerve. This is the tongue, and your this is called carotid artery. Now, this is the vagus nerve. You can see branches of the vagus nerve. These are the branches. Now, glossopharyngeal nerve with the hypoglossal nerve. Now, this is the tongue, the lingual artery, lingual vein in blue, veins of the dorsum of the tongue. This is the jugular, internal jugular vein. Now, tracts of the spinal cord. Fiber bundles having same origin, course, termination, and function known as tracts. Fibers, bundles with the same origin, course, termination, and function are known as tracts. Tracts of the spinal cord: ascending tract, the lateral spinothalamic tract, anterior spinothalamic tract, posterior spinocerebellar tract, anterior spinocerebellar tract, posterior column tract, spinotectal tract, spino-olivary tract, spino-reticular tract. Now, these are the nucleus. These cerebellar, spinocerebellar, cerebellum. Now, anterior thalamic tract to thalamus and the spinothalamic tract. Now, descending tracts: corticospinal tract, reticulospinal tract, tectospinal tract, rubrospinal tract, vestibulospinal tract, olivospinal tract. Now, these are the nuclei, the nerves. Now, the fiber bundles having the same origin. I am stressing on this part. Origin, course, termination and functions are ascending tract, you have a group. Descending tract, you have a group. Now receptors. Receptors excitable to stimuli, termination of an afferent peripheral nerve fiber, physical and chemical stimuli into nerve impulse. Types: exteroceptors, surface of the body, touch, temperature, pain, pressure. Proprioceptors are muscles, tendon, joints, ligaments. Regulation of moves in response to exteroceptive stimulus. Enteroceptors are visceral activities, non-encapsulated, free nerve endings, Merkel's disc, hair follicle. Encapsulated, Meissner's corpuscle, Pacinian's corpuscle, muscle spindle, Golgi tendon organ. Now, what are exteroceptors? What are proprioceptors? Enteroceptors, non-encapsulated, free nerve endings, Merkel's disc, hair follicle. Encapsulated, Meissner's corpuscles, Pacinian's corpuscle, muscle spindle, and Golgi tendon organ. Ascending tracts, here the simplest form of ascending tract, pathway from the sensory nerve endings to the cerebral cortex. Note the three, yeah, sensory ending, yeah. Just going, yeah. Again, ascending, yeah. The thalamus, cerebral cortex. From your book, you make each, you divide, you take your best as your lab notebook. And these nerves, tracts, you make your own writing. And on this left side, you draw the diagram and back. So you can just flip over in the exam time. And also it will be a practice for you and it will be easier to recapitulate, easier to call back when you need it. Now, lateral spinothalamic tract, pain and temperature, alpha, delta and C fibers. Yeah. See this spinal cord. Now, these are the nuclei. You have to practice drawing this for physiology and also anatomy. See, laminae 1, laminae 2, laminae 3, laminae 4, laminae 5, laminae 6, laminae 7. Now, this is the darkly shaded areas, laminae 9 and laminae 8 lateral medially. And dorsomedial, ventromedial nuclei, the phrenic nuclei, accessory nuclei, ventrolateral nuclei, dorsolateral nuclei, and retrodorsal nuclei, intromedial nuclei, intermedial nucleus, dorsal nucleus. This is the lamina, the nucleus called propolis and substantia gelatinosa and postromarginal nucleus. Now you can see another picture. Now this is the level. You see 8. This is the brain, the cerebral cortex. In section, this is the midbrain, and your pons and your medulla here, dorsal root ganglion neuron, temperature, pain. Now C8 up to C8, then T4, lumbar 12, S2. Touch and pressure crudely localized. Now, touch and pressure crudely localized. You can see the lateral corticospinal tract, sacral, lumbar, thoracic, cervical. Now, you can see thoracic, lumbar, sacral, spinothalamic tracts here. So, in the medial, in this is the anterior horn. Now, the most inner side is the cervical, this blue. This is thoracic. Cervical, thoracic, your lumbar and your sacral. Now touch and pressure crudely localized. Even lateral corticospinal tract, sacral, lumbar, thoracic and your cervical. Now fasciculus cuneatus, fasciculus facialis, this is sacral part, lumbar, thoracic, cervical. Now again cervical, thoracic, lumbar, sacral, spinothalamic tract, this cross section. Now this is the tract, ascending tract. See, this is the cerebral cortex. Here the nucleus thalamus, internal capsule, the midbrain, pons, medulla again portion, again collateral is the neural 1, this is in T12 level, neuron 2, dorsal root ganglion, this is dorsal root ganglion, pyramid, anterior spinothalamic tract here, spinal tract, and your ventral, then your posterolateral nucleus, this part, and anterior to the neurons, posterior limb of the internal tract, internal capsule, this is internal capsule, and cerebral cortex. Now, see, this is the superior cerebellar peduncle, inferior cerebellar peduncle, and posterior spinocerebellar tract. This unconscious muscle joint strengths. Nucleus dorsalis, the Clark's column, this posterior spinocerebellar tract. Now, posterior spinocerebellar tract is posterolateral white column of the spinal cord. This. Now, anterior spinocerebellar tract in lateral white column of the spinal tract, spinal cord. Now, this is cerebellum. These are the picture. The spinocerebellar tracts. Now, posterior spinocerebellar tract, third lumbar, muscle, spindle, Golgi tendon organ, joint receptors from trunk and lower limb. Unconscious proprioceptive touch for pressure, posture and movement. Anterior spinocerebellar tract, proprioception from lower limb, general status of posture and movement. The proprioceptor, the touch, and that is going into the general status of the posture. I'm standing like this. I'm doing this. So these postures are controlled by the other day I told you anything problem in the cerebellum, then what are the clinical manifestation, and also your what are the disease condition. Yeah. See your superior cerebral peduncle, yeah, and inferior cerebral peduncle. Now, unconscious muscle joint sense. That I'm standing here, I'm not feeling anything, I'm moving, I'm not feeling anything. But the movement is being carried on. Unconsciously, you just standing, suddenly or you are dancing. You are just doing this. And then suddenly, but that movement, you are not feeling it inside. Okay. Now, the superior cerebral peduncle, inferior cerebral peduncle, and this is the cerebellum, anterior spinocerebral tract, yeah, in lateral white column of the spinal cord, unconscious muscle joint space. Now posterior spinocerebellar tract, nucleus dorsalis, Clark's column. It's the whole spinal cord, how the tract is going. Refer to your textbook. Posterior column tract. Now you can see the spinal cord, the lateral corticospinal tract, the sacral tract, lumbar tract, thoracic, cervical. Now fasciculus cuneatus, fasciculus gracilis, sacral, lumbar, thoracic, cervical. Again, cervical, thoracic, lumbar, sacral, spinothalamic tract, anterolateral system. Here the posterior column tracts are here. You see, you draw this section, cross section, and first this is the cerebral cortex. Now this is the midbrain, this is the pons, this is the medulla. C1, P4, L4. Now you draw and then you start leveling it. Practice with 3 colors. At what level your intersection is happening. Now posterior column tract, proprioceptive, perception and vibration. Now the fine touch, 2-point discrimination, tactile localization and stereognosis. Now proprioception, vibration. Your joint, that is your vibration, that's going in. Now proprioception, you feel. Fine touch, you feel. 2-point discrimination. You ask a patient to close the eyes, you tell him 2 points you locate, and then you see he's touching 2 places. You tell him, you show him this neck, anterior part of the neck. You see the forehead. Then can he distinguish the 2 points? And your tactile location, the tactile location is you have to locate. And stereognosis. Stereognosis, see, all of a sudden, It's load shedding, dark, and also you have coin in your pocket. 5 coin, 1 5 rupees, 1 2 rupees, 1 10 rupees coin. And blind people, they feel and they, and also if you want to take a coin, you feel it. Close your eyes. If anyone gives you, say I give you 10 rupees coin, you feel it. I ask you how many rupees is this? Oops. You will say 10. Then you will say 5. You will say 1. But this is, you are blind, and with recognition senses they can differentiate the what is the coin. Or I have left my watch in my drawer. There's load shedding. I suddenly come like this. Then I open the drawer. It's pitch dark. No light is there. Then I want to take my watch. See the watch here. I open the drawer and I search, and then I feel the watch. Now, another thing, tactile location. See, if I scratch you here, I kotai dag dij, hath dij. Now, again, you ask the patient to close the eyes and ask him to touch the lungs. You're with your boyfriend. Now he blindfolds you with a hanky, and you just stand and say, okay, come where I am. But she'll go like this, suddenly go, she'll go tongue and bang his head, knock his head, and ultimately he touches you. Full voluntary movements of the non-postural type, speed and agility, moderate sensory points, corticospinal tract. This skillful voluntary movement of non-postural type, speed and agility is controlled by the corticospinal tract. Modulate sensory point input, smooth performance of movement, flexor muscles of the distal parts. Cerebral cortex. This is the midbrain. This is the pons, upper part of the medulla oblongata, the lower part of the medulla oblongata, thoracic part of the spinal cord, alpha motor neuron here, gamma motor neuron here. Now, corticospinal tract. Now, this is the picture, the homunculus of the motor area of the cerebral cortex. This is the body, this is the foot, and this is the thumb. This is the thumb and the fingers of the hand here. And see, a face is drawn here. Now the face is drawn here. This is the corona radiata, posterior limb of the internal capsule, corticospinal tract in middle 3/5 of the basis of pediculi, midbrain here, and corticospinal tract in pyramid of medulla oblongata, anterior corticospinal tract in anterior white column of the spinal cord, this, and site of decussation of pyramids here, and lateral corticospinal tract in lateral white column of the spinal cord. Now this picture, if you please, you have your tab there, you download and see. This is the picture, similar picture, but in Gray's anatomy, it is beautifully depicted. It's okay, but by projection it is bit. But when you see image in front from the book or your tab, Gray's anatomy, you just look at the picture and you can take a picture of your in your phone. This part, the homunculus of the motor area of the cerebral cortex. From this part, this part, this. Now, rubrospinal tract. Now, this is the cerebral cortex. This is your red nucleus, globus embryoniform rubral pathway, deep cerebral nuclei, and rubrospinal tract in lateral white column. Here's the nuclei, red nucleus, rubrospinal tract is the lateral white column of the spinal tract, lower motor neuron. At this level, if there is an injury, then if you ask what type of lesion it is, lower motor and upper motor. Now you see the cerebellum here, lateral vestibular nucleus, your deep cerebral nucleus, and this is the vestibulospinal tract in the anterior white column in green. In green, this is the vestibulospinal tract in the anterior white column of the spinal cord. Now, lower motor, here's the lower motor, the vestibular nerve, here, Khan, here, reticulospinal tract. This is the thalamus, this is red nucleus, midbrain, pons, reticular formation. This is reticular formation here. Medulla oblongata, medullary reticulospinal tract. These in pink or purple. Now this is in blue. Now you can see lower motor neural lesion. The lower motor neuron. Pontine reticulospinal tract, these two. Now cerebellum, deep cerebellar nuclei, and this is thalamus, reticulospinal tract. Now, tectospinal tract, this is the eye. Now, you can see your tectospinal tract in the anterior column of the spinal cord ascending and goes down there. Olivospinal tract, cerebellar cortex. Now, globus pallidus, here, red nucleus, descending tracts from higher content centers. These are the higher centers here. And inferior olivary nucleus, ascending spino-olivary tract, and olivospinal tract in the anterior white column, lower motor neural lesion. There is now considerable doubt as to the existence of this tract as a separate pathway, olivospinal tract. Now, lesions of the spinal cord. Spinal cord injuries, traumatic, accident, gunshot, fall, stab wounds, fractures, dislocation, ligamental tear. Now, non-traumatic, disc prolapse, infection, abscess formation, vertebral subluxation, spinal neoplasm. Now, what are the spinal cord injuries? The traumatic and non-traumatic. Accident, gunshot, fall, stab, wounds, fractures, dislocation, ligamental tear. Long, non-traumatic, disc prolapse, infection, abscess formation, vertebral subluxation, spinal neoplasm. Now, complete transaction. Above third cervical segment, paralysis of respiratory muscles unable to survive. Below fifth cervical segment, quadriplegia, quadriplegic, paraplegic, complete loss of all the sensation and voluntary movements. This is very important, this upper motor, lower motor neural lesions, and also if a patient is brought to you in the emergency, you just do some simple clinical tests. You can give this patient won't survive. But in modern days, you need not utter this. You refer to super specialty trauma center. But by that time, he goes the respiratory loss gone. But if you say, Kero, Doctor, chesta korchen na keno? Why are you not trying? Bachan, amar rugitaকে বাঁচান। তখন তারা তো আপার মোটর, লোয়ার মোটর কোথায় সার্ভাইকাল লেভেলে ট্রমা হয়েছে, কোন নিউক্লিয়ারটা চলে গেছে সেটা না। You have to give oxygen and this thing, and then you write now, এটা হবে না এটা। Send it. Now, see, above third cervical segment, paralysis of respiratory muscles, unable to survive, because paralysis of the respiratory muscles. Now, below fifth cervical segment, quadriplegia, all the both quadri, upper limb, both lower limb, both paralysis. You will encounter in your students, when you are a student in clinics, you will encounter a quadriplegic, your paraplegic, complete loss of all sensation in voluntary movements. Anterior incomplete lesions, anterior cord syndrome, posterior cord syndrome, central cord syndrome, Brown-Séquard syndrome. Lesions of the spinal cord. Yeah. You have it in your books. You draw these diagrams. When you are reading neuroanatomy, please, you make a book, a khata, and you have the pages draw, and you label, and also write short notes on. Today, at least a portion of it. Tomorrow, another portion of it. The whole talk that I delivered, from your book, you try to make a khata, and that will be your revision, because you will go for exams after 2 months. रटेगा नहीं होगा. At least see, at least draw, if you could say, the lesions of the spinal cord, complete cord transaction, whole things are anterior cord, anterior cord syndrome, central cord syndrome, and Brown-Séquard syndrome. If you draw this diagram, say I am giving you 4 marks for each, you label it first. At least the examiner knows that you have attempted, you will get 3. You give an explanation, but this will be enough. Now, anterior cord syndrome, flexion injuries, dislocation, disc protrusion, wedge fracture of the vertebral body, contusion, injury to anterior spinal artery, C4 to C7, T12 to L2. Now, posterior cord syndrome, a rare condition, fracture of the posterior elements, avulsion fracture. Now, hyperextension injuries, whiplash injuries, congenital or degenerative narrowing of the spinal cord, more severe involvement of upper extremities, sacral sparing. Sacral is spared. Brown-Séquard syndrome, this is the short note can come, hemisection of the spinal cord, stab wounds, compression due to extramedullary tumors. On the side of the lesion, damage of posterior funiculus pyramidal tracts. On the contralateral side, damage of lateral spinothalamic. Simple straight line drawings. If you don't have to draw muscle and this thing, nice haircut, you don't have to. You just have to explain, and you just take the three colors, you shade like this. You just like this. I'm just saying. Now that gives you an see lesion on this side, total loss of all sensation, hypotonic paralysis, loss of tactile discrimination, vibratory and proprioceptive sensations, spastic paralysis, loss of pain, temperature and sensation, impaired tactile sensations.